Good. Is Dr. David Porter in the room? Hello, Dave. Would you like to come up, please? David, you've seen the format. We have 5 minutes together and some questions, hopefully, at the end, if you're able to make space. But fundamentally, this time is yours to tell us what we need to know. So welcome, David. Please go ahead.
Thank you. I would hope that most of that time would be for questions from you to me. In fact, the last submitter could not have done a better job of summarising what I hear from hundreds and hundreds and hundreds and hundreds of patients in my practice. So I'm a rheumatologist, and by nature I see a lot of chronic pain. Roughly 75% of that will be due to diseases where the immune system malfunctions and causes inflammation within some body system, often the joints, which is why rheumatologists are associated with arthritis, but often all round the body as well. And I plucking a figure out of the sky, I think about 75% of my patient load would be that. And I think they, in general, are exceptionally well served by Western medicine and conventional medicine. I think the tools that I've got in that side of my job are really good. I have no idea whether CBD is good for that side, but I'm not particularly interested because I have a lot of options. However, that leaves about 25% of patients who are exactly like the lady that just talked. They're exhausted. They are in chronic pain all day. Their brains don't work properly. They can't find simple words. They can't do simple calculations. And they're extremely disabled by a problem that is invisible to the outside world. So 5% of the female population, or perhaps 5%, walking around the streets of Wellington today have an existence like that. They look well, and they are constantly frustrated by the fact that they look well, but they feel goddamn awful in just about every respect. And the tools that I have available to me for that, amitriptyline she mentioned, nortriptyline she mentioned, we can go into codeine and then up the opioid scale, which nobody wants to do. I would estimate about 10% of patients do pretty well on any one of those agents, but when I write a prescription for it and I hand it across the table, my heart literally sinks. I think I'm almost certainly the odds of me doing you harm with this are far greater than the odds of me doing you good with this. And nothing I have learnt about medicinal cannabis at all came from medical school or continues to come from the medical profession, although that's very slightly changing. The awareness is growing, and I think things will explode in the conventional medical world. But everything I've learnt is off patients, really, and by extension, they have brought me into contact with people who supply them because they can't find a supply anywhere else. And that woman's testimony is what I hear from hundreds and hundreds of patients. Everything else makes me feel worse. This thing has never given me a side effect. I quite literally can look you in the eye and say I have not had a single patient in my whole practicing career who has complained of a CBD-related side effect. It's absolutely unique in that respect. And I have been staggered by the number of patients, and more particularly, just like some of the individuals that have been profoundly helped by this medication, absolutely life-changing, I would have thought were utterly unfixable. And that impression just gets reinforced every day of my working practice. And I probably don't have much more to say to that. I think that regarding it as a drug is almost erroneous. I think it should be thought about in people's heads as the equivalent of green-lit mussels, fish oil, turmeric. I think it almost to me is a nutritional supplement that happens to be damn good at what it does for a lot of patients. My guess is 10% failures. This is from patient feedback. It just doesn't work for them. 10% miracles, where I would have thought completely unfixable people have had their lives transformed, and most people somewhere in between. But so importantly, never a side effect.
David, you talked about the CBD. Do you have any experience with THC? Reframe that. Yeah, in your clinical practice.
I went to university, but I didn't inhale.
Yes, Mr. Clinton, keep going.
I do, and
if your patients are using black market product, it can't be CBD will be full spectrum.
Okay, so we'll generally, thank you for that, but we'll generally just stay in committee questioning.
I have a range of patients who have a range of suppliers who, for the most part, in my practice, and I've steered them very specifically towards the low THC products. Not because I don't believe in THC, but because a lot of my women are in their they're largely women. I think THC has a really important role to play, but I don't know quite where that fits in. I think get the first thing through the door first.
Right. We have time for another question. Angie, do you have a question? Liz?
Just thinking with your...
Just one comment. One of the major problems in people's lives who have fibromyalgia and chronic pain is that they can't sleep, and many doctors think, the academics in the field might feel that may be the actual fundamental problem. And again, feedback from patients, I think THC is really, that's its main role that I've observed. People, somebody behind me gave one of these incurable ladies some brownie. Purposely has a little bit of THC in it. Mm-hmm. She came back after a weekend. I think she got it on a Thursday. She came back with tears rolling down her cheeks on the Monday, and I'm about to burst into tears thinking of her. I've slept for the first time in 3 decades, and that's utterly profound, and it makes such a difference to them.
Last question, Ms. Craig.
As a clinician, obviously, there's research based, and I guess the thing is what you're saying is you're seeing this huge impact on people's lives. But yet, what's your sense of where the medical research is at? And it's a mystery.
I think it's clearly it's miles behind. My superficial understanding is that because medical research was specifically blocked in the US in particular for so long, things are rapidly catching up. So the people in the field know things, and they've known things for years. And I think seizure disorders, childhood seizure disorders in particular, are the biggest example of that. And this year there's been big papers in the New England Journal and the Lancet unequivocally saying that this is a quite fantastic addition to the armamentarianism. And I think the conventional medicine will actually explode. It'll come on board very quickly. But the other thing, it's incredibly conservative. I work in Nelson. I think we're a fairly open-minded community in general. I spoke to my physician colleagues at the hospital there just about just what I've told you, and the resistance I got was, and remains, completely baffling to me. A group of people who are trained to weigh evidence, look at evidence, it's like, drugs are bad, marijuana's bad, I'm not even going to listen. But I think that all changed fast.
David, you've travelled from Nelson, and you've certainly brought a lens onto this discussion that's been very, very useful. So thank you very much today. Thank you.